Bismillahirrahmanirrahim. Today is the second part of the lecture, which is direct retainers. This lecture is intended for third year BTS students. My name is Dr. Uzair Ahmed. So, as we have discussed previously in the previous lectures, that there are two types of uh, basically the extra coronal retainers or the clasp assemblies that we discuss. First one is the class designed to accommodate functional movements, which we have to give in Kennedy's class 1 and 2 cases, and sometimes in class 4 cases as well. Though those clasps include RPI, RPA, and bar clasps, or the combination clasp. Today's topic is clasps that are designed without movement accommodation, like in examples of Kennedy's class 3, and in cases of small modification areas which are anteriorly and posteriorly bounded by abutment teeth. The example of these clasp assembly is circumferential clasp. Circumferential clasp, basically it looks like this. This is the most familiar type of clasp assembly to students. There are different parts of the circumferential clasp arm. It basically originates and joins to the major connector with the help of a small minor connector, which leads to a body of clasp. From body of the clasp, all other parts of the clasp originates, which includes rest, the the reciprocal arm, and the retentive arm. We all know that there are some basic principles of all these parts. Rest has its function to give support to the denture. The retentive arm has its function of giving retention, and reciprocal arm has its function of giving the reciprocation of deleterious forces that are applied during uh, retentive arm functions. We all have been through that in the previous presentation as well. So moving on with the circumferential clasp, we see that circumferential arm, another um, identifying point of circumferential arm is its origination. It originates from the occlusal and goes towards the cervical end, as compared to the I-bar clasp arm, in which the retentive arm originates from the cervical and moves towards the occlusal surface. So the circumferential there are some specific disadvantages of the circumferential clasp arm as compared to the I-bar clasp arm. This is the circumferential clasp as viewed from the occlusal surface, and this is the I-bar clasp arm as viewed from the occlusal surface. Now the most obvious disadvantage is more tooth surface is covered in the case of circumferential clasp arm, which leads to more contact, more wearing of the metal or the tooth, or it may lead to the carious involvement of the teeth in the areas of clasp contact. Another disadvantage of occlusally approaching circumferential as clasp arm is that their occlusal approach may increase the width of the occlusal surface of the tooth. Like in this case, or in this case, you can see that the occlusal surface have been increased, which leads to more um, transfer of forces to the abutment teeth, and which can and cause deleterious force transfer to the abutment teeth. Also, another disadvantage that we can see in this picture is more metal display as compared to the I-bar clasp arms. So the circumferential clasp arms are more or less aesthetically you can say I-bar clasps are more aesthetically acceptable to patients as compared to the circumferential clasps. Also, the half round form, we know that half round form is only is it is a possible half round form is only possible when the clasp is cast. Otherwise, in cases of combination clasp, we can use the round shaped wrought wire wrought wire metal clasp arm as well. But in cases of circumferential clasp arm, the cross section is always half round in shape, which is difficult to adjust. It can only be moved towards or away from the tooth in order to increase or decrease the retention. which is a disadvantage. Another type of circumferential clasp arm is a ring clasp arm, ring clasp, in which you can see that there is a rest which is provided in the form of occlusal rest, and a lingual approach is included. A bar, a clasp arm originates from the lingual surface. It goes all the way towards the opposing proximal surface to the buccal surface and engages the undercut of which is present in this area. Also, in ring clasp, because of this long uh, course that the clasp arm takes during engagement of the undercut, it has to have a supporting strut which should be present on the lingual surface. If the undercut is on the buccal surface, then this supporting strut should be on the lingual surface, and in doing so, this lingual portion, it acts as reciprocal arm, and the retentive arm is it starts from this supporting strut on the lingual surface towards the buccal surface. This you can see that this is the buccal surface, and the undercut has been engaged by the help of terminal end of retentive arm. Um, Here you can see that to increase the stability of a ring clasp, two occlusal rests have been accommodated on the abutment, both on the mesial and distal proximal surfaces. To increase, because you know that rest is given to increase the support of the prosthesis. Embrasure clasp is another type of circumferential clasp arm. We know that if we see this picture, this is a Kennedy's class 3 with no modification area present on the opposing side. So we cannot make a cast partial denture which only extends over this area. It has to extend over this area as well and engage these abutment teeth as well. If that is the case, in which the opposing side does not have any um, modification surface, then embrasure clasp can be used over this area. I will show you embrasure clasp in the next slide. Also, in this um, case, this is a Kennedy's class 2, in which there is only one side of the arch has a edentulous space, and the other side has no edentulous space or the modification area. So embrasure clasp can be used in this area. Here you can see that embrasure clasp, basically the it engages not one tooth but two adjacent tooth or two adjacent teeth, and the in interradical, or you can say interproximal area, is used by two rests are provided on both the teeth, and an interproximal rests are provided for better support, and then from these rests two retentive clasp arms originate over two adjacent teeth. Here you can see that two one mesial and one distal occlusal rest has been provided, and from this two retentive arms will be provided on both these abutment teeth. To this more than one abutment has been introduced in the area where there is no modification space, because we need more support, more retention, more stability on from the opposing area as well, because of lack of any modification space or edentulous area in that side of the of the patient. Here you can see an example of embrasure clasp, in which occlusal rest has been provided, and from there two retentive areas are engaged. Moving on, these following clasps that we will discuss, they are only for historic purposes. They are not very commonly used nowadays because of their complicated designs, and their you can say their designs cannot be um, the these designs cannot are not justified basically. Here you can see that the back action clasp, in which there is a minor connector, and then there is an occlusal rest on the opposing side, and then from there a retentive arm originates. This is called the back action clasp. This is the multiple clasp, in which there are two abutments involved but on the opposing surfaces, and from two occlusal rests there involves a retentive clasp arms, which is in the bottom area, and in the two reciprocal arms are basically connected to each other. This is called the multiple clasp. The retentive clasp arms are not connected to each other, but the reciprocal clasp arms are connected to one another. Next one is the half and half clasp. This is also for historic purposes. Basically, the main definition of half and half clasp is that its retentive arm originates from different occlusal rest, and the reciprocal clasp arm originates from the different occlusal rest. So this is called half and half clasp. Reverse section clasp is basically when you have to engage the undercut, which is directly below the proximal surface from which the clasp is originating, like this, in which this is the rest, and if we want to engage this undercut, and we cannot make the clasp in the shape of this small needle shaped retentive arm. So a long retentive arm which is present on the supragingival area, you can say suprabulge area, and then only the retentive clasp arm engages the undercut from which is present in the cervical area. The reciprocal clasp arm is conventionally designed in this type of clasp.